Here's an in-depth article about one of the most dangerous drugs that can be misused on an empty stomach, explaining its dangers and offering guidance on how to use it safely. Understanding the risks of taking ibuprofen on an empty stomach. Ibuprofen is a commonly used nonsteroidal anti-inflammatory drug, NSAID, effective in treating pain, inflammation, and fever. While it is generally safe when used according to guidelines, misuse, such as taking ibuprofen on an empty stomach, can lead to severe health risks. Understanding these risks is crucial to ensure safe usage and to avoid potentially life-threatening complications. 1. The mechanism of ibuprofen and the stomach's role. Ibuprofen works by inhibiting enzymes called COX-1 and COX-2, which produce prostaglandins responsible for pain and inflammation. However, prostaglandins also protect the stomach lining by promoting mucus production. When these are reduced, especially on an empty stomach, the stomach lining becomes vulnerable, increasing the risk of irritation and damage. 2. Health risks associated with taking ibuprofen on an empty stomach. Taking ibuprofen without food can expose users to several health risks. A. Gastric irritation and ulcer formation. Ibuprofen can irritate the stomach lining. Without food, the stomach acid can attack the exposed lining, leading to gastritis or, over time, painful ulcers. Long-term or repeated misuse can increase this risk, especially for those with a history of gastric issues. B. Gastrointestinal GI bleeding. One of the most severe risks of taking ibuprofen on an empty stomach is gastrointestinal bleeding. This can happen if the stomach lining deteriorates enough for bleeding to occur. Symptoms might include black, tarry stools, vomiting blood, or severe abdominal pain. In extreme cases, GI bleeding can be life-threatening and requires immediate medical attention. C. Increased risk of kidney damage. Ibuprofen can also impair kidney function, particularly if taken without proper hydration or food. Kidneys rely on prostaglandins to regulate blood flow, and blocking these can reduce kidney efficiency. People with pre-existing kidney conditions are especially at risk when using ibuprofen improperly. D. Cardiovascular complications. Long-term misuse of NSAIDs like ibuprofen has been associated with an increased risk of heart attack and stroke. Although these risks are primarily linked to prolonged use, improper use, such as taking high doses on an empty stomach, can compound the risks, particularly in those with pre-existing heart conditions. 3. Safety tips to prevent ibuprofen misuse and minimize risks. To safely use ibuprofen and avoid complications, follow these tips. A. Always take ibuprofen with food or milk. Food helps to buffer the stomach lining, reducing the risk of irritation. Milk can also provide a protective layer, offering an alternative if a meal isn't available. B. Stay hydrated. Drink plenty of water when taking ibuprofen, as this supports kidney function and assists with the drug's absorption. C. Follow dosage guidelines. Always follow the recommended dosage on the label or as prescribed by a doctor. Taking too much ibuprofen can increase the likelihood of serious side effects, particularly if taken on an empty stomach. D. Avoid prolonged use. Ibuprofen is intended for short-term use. If you experience ongoing pain or inflammation, consult a healthcare provider to explore safer long-term treatment options. E. Be cautious with pre-existing conditions. People with gastrointestinal, kidney, or heart conditions should be especially cautious with ibuprofen. Consult with a healthcare professional before using it, as they may recommend alternative pain management strategies. F. Monitor for side effects. If you experience symptoms like stomach pain, heartburn, or signs of gastrointestinal bleeding, such as black stools, stop taking ibuprofen immediately and seek medical help. Conclusion. While ibuprofen is a powerful and effective medication when used correctly, taking it on an empty stomach can lead to severe health risks, including gastric irritation, bleeding, and even kidney damage. By following safe practices, such as taking it with food and sticking to recommended dosages, users can minimize these risks. Always consult with a healthcare professional for long-term pain management solutions and consider alternative treatments if ibuprofen proves problematic for your digestive health.